Okay, our next topic is diet and nutrition and Parkinson's. We have an excellent panel, some excellent questions, and again, we will be soliciting questions from the audience as well. So if you could please take a seat. Thank you. So as promised, I have a dad joke for each panel. So I turned down a job where I got paid in vegetables. The celery was unacceptable. Okay, so our next panel is nutrition and diet with Parkinson's, which is kind of, I was talking to our panelist, it's kind of like the Wild West of Parkinson's now, because there's just a lot of information out there, but not a whole lot of studies. So there's a lot to sort through. So we're very fortunate to have the panel today. So I'm going to introduce them. First, we have Dr. Fay Gao. Dr. Gao is a neurologist specializing in the diagnosis and treatment of movement disorders, which includes Parkinson's disease, tremor, dystonia, Huntington's disease, and tics. She has a special interest in brain stimulation for treatment of Parkinson's disease and other movement disorders, as well as Botox therapy for various neurological disorders. Dr. Gao is a member of the American Academy of Neurology, the International Parkinson's and Movement Disorder Society. She is also an assistant clinical professor of medicine at the University of Hawaii at Manoa John Burns School of Medicine. Dr. Gao grew up in Boston, Massachusetts, so don't hold that against her. She also enjoyed skiing, snowboarding. She prefers summer activities of bicycling and hiking, which led her to seek a warmer climate. Her hobbies include drawing, painting, and photography. So welcome, Dr. Gao. Thank you. Unfortunately, one of our panelists, I talked to her yesterday. She sounded awful, is sick. So Dr. Canyon, I just want to thank her for agreeing to be here, but unfortunately, due to having a little bit of a cold, she will not be here. But if we do have some questions that aren't answered, Dr. Canyon and the rest of the panel will answer again those questions, and we'll post it on the website. Our other panelist is Alyssa Los. Alyssa has been a registered dietitian for 6 years, where she specializes in plant-based nutrition, lifestyle medicine, digestive wellness, oncology, and global health. She acquired her registered nurse degree and is currently pursuing her Doctor of Nurse Practitioner degree to combine medicine and nutrition to create a holistic approach to patient care. She employs motivational interviewing techniques, SMART goals, we'll have to ask her what those are, SMART goals, and trans-theoretical model of change to help clients create sustainable changes. Her passion lies in helping clients reduce social economic barriers and comorbidities with conscious lifestyle choices. She hosts group community outreach programs to teach clients about the benefits of lifestyle medicine, 7 principles involving movement, nutrition, social connection, nature, managing stress, having adequate sleep, and avoiding unhealthy substances. So welcome, Alyssa. Okay, we're going to jump right in. We had some questions submitted earlier, and they're actually quite good. So let's start with this one. Can I ingest or get more dopamine from eating certain foods? Will that help my symptoms, or do only pills help?
Go ahead.
All right. Hi, everyone. Aloha. So we would recommend trying to take your pills over the food. There's very small amounts of dopamine in the food, so we would certainly recommend utilizing medication first.
Mm-hmm. I will add that, can everyone hear me?
Yeah, if you guys could hold the mics a little bit closer. Yeah.
Is that better?
Yes.
Okay. So the food content of, the dopamine content of food is usually pretty minimal. Plus, any dopamine that gets absorbed into the body usually doesn't get to the brain. So the brain typically makes its own supply of dopamine. That being said, the ingredients that the brain requires does come from food. And these include proteins called amino acids, the most important of which is tyrosine. So tyrosine is typically found in lean protein like poultry, eggs, and plant-based protein like beans and legumes. So I would say those are good sources of the ingredients that your brain uses to make dopamine.
Great. Next question. I'm aware that exercise can potentially be neuroprotective and slow down Parkinson's progression. Can diet do this as well? And if so, what should I be eating?
You want to take that? Okay. So there's a lot of different research studies suggesting that there's various diets that can help. One is the Mediterranean diet, which is really rich in healthy omega-3s. We've also seen plant-based diets can help as well. In addition, we've seen what's called a protein redistribution diet. So having our protein later on in the day, because the medications that we take kind of compete with the protein that we're absorbing. So we've seen quite a few different studies showing that we don't really have a definite, this diet is what we would recommend. However, I would try to utilize all those different diets. So trying to have as much healthy fats or unsaturated fats in our diets from avocados, salmon, nuts, seeds, as well as trying to have a more predominantly plant-based diet and trying to have our protein later on in the day. Those are all the things I would recommend. I think we're going to kind of get the benefits from all of that by doing all those 3 different diets.
Okay, another question. I keep losing weight that I don't want to lose. What's happening and what can I do about it?
Yeah, so weight loss can come from a variety of different reasons, particular to Parkinson's disease. People can have weight loss because of trouble eating, chewing, and swallowing, therefore not actually getting food in. They also often have GI issues like delayed gastric emptying, which I think there's another question coming up, and slowed kind of GI transit. That can affect the absorption of food. They also have reduced appetite because of loss of smell and taste, very common in Parkinson's, as well as from other factors like depression or cognitive impairment. So addressing all of the factors between each individual's reasons for the weight loss is really essential. So it's important to bring it up with your visit with your provider. In terms of kind of general nutritional strategies, I'll let Alyssa give us some good tips.
Sure. So the first thing I would always recommend is having small, frequent meals. So trying to increase our caloric intake by having, maybe 5 meals a day instead of our 3 big meals. That's going to help increase the amount of calories that we have. In addition, usually trying to get calories through liquids is a really great way. So having smoothies, soups, things of that nature, and trying to add in as many high-calorie foods as possible. So avocados is a really good one. Blending some avocados in with your smoothie is a really great way to get those healthy fats, but also get higher calories. We can also add in a lot of nuts and seeds throughout our day too. Those are also going to be higher in calories and have those omega-3 benefits. So there's multiple different ways that we can do it, but usually the small frequent meals and having beverages with high calorie foods is what I would recommend.
Great. Next question. I am constipated all the time. Is there anything I can do with my diet to help that?
Yes. So the number 1 and 2 things you can do to reduce constipation are drink more fluids. That's number 1, and probably also number 2 and 3 and 4 and 5. And then the next one after that is to eat more fiber. So those 2 are often deficient in people with Parkinson's for a lot of reasons. A lot of my patients don't want to drink water because then they have to go to the bathroom a lot, right? So we have to work on a good plan, a strategy, and that might include, addressing bladder control, urinary frequency through different ways. But ultimately, the increased hydration is essential. And the reason that is because our GI tracts are designed to extract, as much nutrition and water as possible from our food. And when our bodies are lacking in hydration, the GI tract actually will work harder to take all the water from what we take in, and that results in hard, impacted stool. So the number one way to improve that is to increase your water intake. And then adding fiber also actually helps to move the food through the intestine and sort of not let it stay in there and get hard and impacted.
Yeah, I absolutely concur. Hydrate, hydrate, hydrate. I would also, to add to that, we have two different types of fiber. We have soluble fiber and insoluble fiber. Soluble fiber is usually what adds bulk to our stools, and insoluble fiber kind of helps with that movement. So trying to focus more on insoluble fiber is going to be your friend, and you can kind of look up a list of all the different foods that have that. Most foods have both soluble and insoluble fiber, but some foods have a little bit more insoluble fiber than soluble. So things like quinoa, some beans, quite a bit of fruits and vegetables focus a little bit more on insoluble fiber.
Alyssa, how much water do you recommend people drink a day?
I would actually try to go around about 90 ounces a day, which is quite a bit. So do what you can. Usually if you can do about 1 milliliter per kcal, so if your average diet is around 2,000 kcals, then you're going to try to strive for 2 liters. But we do try to increase our fluid as much as possible, and striving around 90 to 92 liters is usually what most people recommend for helping with hydration.
So do we have any questions from the audience? Yep. Jan, wait for the microphone if you don't mind.
No, I'm sorry.
Are you trying to take my job, though?
Question about the protein, because you said the brain for the dopamine you need the protein. Is there a difference between animal protein and plant-based protein?
Did we answer? You got that? Yeah. Okay. So when it comes to absorption for protein, they're gonna kind of act similarly. With plant-based proteins, we have complete proteins and incomplete proteins. So animal proteins are gonna have those complete proteins, which means it has all those amino acids, versus plant-based proteins don't always have all those amino acids. But things like quinoa, for example, that's a complete protein and it's still plant-based. So they're still gonna kind of both affect the absorption of the medications. So it doesn't entirely matter if you're doing plant-based versus versus animal protein when it comes to absorption.
But volume-wise, do you have to eat more plant-based compared to animal?
To get a certain amount of grams a day? Yeah, so usually animal proteins do have a little bit of a higher protein intake than some other plant-based proteins, but it kind of just depends. Like soy is pretty high. I think that's about like around 9 grams for half a cup of tofu. There's ways to get in your protein through plant-based proteins, yeah. So I would still try to recommend trying to have more plant-based proteins if possible. And if you are trying to utilize meat or fish, going for fish is going to be higher in those omega-3s. So trying to have fish is another good way. But we've just seen a lot more benefits from utilizing plant-based proteins over some of those like red meat proteins. That's going to cause cardiovascular diseases and other negative effects.
Yeah, I will add to that from a nutritional profile, not all proteins are equal, right? And there's more and more evidence coming out that red meat protein and whole fat dairy actually are pro-degenerative. So there's a correlation between high consumption of red meats and whole fat milk and dairy, et cetera, with higher risk for developing Parkinson's disease and Alzheimer's disease. So actually, we often recommend minimizing those sources of protein. So the fish and lean poultry, eggs, low-fat milk, those would kind of be what we recommend for animal-based protein, with no limits for plant-based protein. Would you agree?
Yes, yeah, I would agree with that.
Great. Any other questions from the audience? If you can wait for the mic, sir.
For constipation, when should you get concerned about it? After 1 day or 2 days or 10, you know? 10 days. I'm kind of new to this, so.
I'm going to just repeat the question. So the question is, when should you start worrying about constipation, like 1 day or 2 days or so?
Yeah, it depends on the individual, and actually there's not really a set definition for constipation because the regularity of your bowel movements is very different from person to person. So generally it's, whenever it gets bothersome to you is the formal definition of constipation. So if your regular is having a bowel movement every 2 days, then that's okay. That's not necessarily something to be worried about. But if suddenly you go 3 days, 4 days without having a bowel movement, that is something to be concerned about. I will say generally it's a lot harder treating constipation when it's gotten to that point. It's always easier to prevent it. So prevention with hydration and fiber is far, far better than dealing with it as it comes.
Do you have any tricks on how to take care of it?
So going back to the fluids and the insoluble fiber is what we would recommend.
Once it's occurred.
Once it's occurred, I would still recommend having fluid and insoluble fiber even once it's occurred. It depends how far along you are. Like if you haven't had a bowel movement for maybe 5 days or so, you might have to seek going to, urgent care or the emergency room and, getting an enema or something else of that nature. However, if you're able to just kind of drink a lot of fluids and it's only been a couple days, then you're able to kind of help pass that on your own.
Yeah, so I think to answer your question, combination of laxatives, other medications, but ultimately if it's to the point where nothing is passing through and you're potentially obstructed, sometimes the only way is to go from below. So that could be with an enema or going to the urgent care or ER to get a manual disinfection. No worries. It's an important and common topic. Yeah.
I was at a caregiver conference years ago, and somebody brought up a recipe called power pudding, which is a prune-based thing. I don't know if you heard of that. Or,
Yeah, sometimes in the hospital we'll give people prune juice and melted butter and mix that together, and that can help too. Prune juice helps kind of act as a natural laxative. So it depends how far along you are, if you're able to use food and, beverages to get it out. But if it's even farther along, then yes, going to laxatives and enemas is what we'd recommend.
Okay. You have a question? Can you wait for the mic? It's coming right to you. Thank you.
I'm a pediatrician, but I was going to comment on the younger kids. We tell them not to withhold and make use of your, gastrocolic reflex. Sit down on the toilet every day after dinner or breakfast to regulate yourself.
And movement helps too, right? Like a lot of times if we even just start walking around more and exercising, that's going to help our GI tract start moving a little bit better too.
Tommy, you have a question?
Yeah.
I recently bought a vitamin. I blend spring mix with the with a banana, an apple, and blueberries, and raspberries and blackberries, and that seems to help my regularity.
Right. Yeah. The more fiber helps with that regularity.
The one thing I didn't think of adding was avocado to the smoothie. But if I mix that many, I remember reading a book when I was in college called Food is Your Best Medicine by Herbert Benson. I don't know. But they recommended eating one type of food at a time. And I wondered whether you thought that was valuable or not. When I mix all those vegetables together, those fruits together, I like it, and it tastes good, but I don't know whether it's good for me to mix that many things together. So do you understand the question?
So Tommy was describing a concoction that he makes that includes a lot of fruits and bananas, and I think the take-home theme is that all that has fiber, and that's extremely helpful. For that, awesome. Okay, all right. Thank you, Tommy.
Thank you for sharing.
We have a couple of questions. This gentleman here, and then we'll get you after that. So the gentleman with the hat with it.
I just had a question about protein supplements, like protein powder. Is that okay to take today?
Protein supplements, is that what you were talking about?
Protein powder that you can add in your drink, or?
Yeah, absolutely. That's something you can incorporate. Again, if you're utilizing that protein redistribution diet, I would recommend having your protein later on in the day because, again, it's going to compete with that medication. So having a protein shake later on in the day would be totally fine. If you feel like you can't get your protein in through foods, you might need to have protein supplements through powders.
How much protein should you be taking every day?
Yeah, that's another good question. So for the general person who has Parkinson's, I would recommend about 0.8 grams per kilogram. So what you can do is take out your little calculators and you can take your weight, divide it by 2.2, and then multiply that number by 0.8, and that's how many grams. That might be a little too intense, but
There will be a quiz.
but if you want to know your personal protein grams, that's what I would recommend for you. Yes, so it's going to be your weight divided by 2.2. So your weight in pounds divided by 2.2, that's going to equal your kilograms. Yeah. And then once you have that number, you can multiply it by 0.8. Yeah. And that's going to be, if you're exercising a lot, you're going to have more and maybe see a dietitian to kind of see where you fall with the protein grams. But if, you're kind of just, living your regular life, that's the amount of protein grams I would recommend for each person individually. Yeah.
Mm-hmm. I have another question for Alyssa. Going back to the constipation topic, are there any foods that are bad that can promote constipation that we should avoid?
Yeah, so foods that don't have fiber in it, right? A lot of times that comes from processed foods or, deep fried foods, things that are going to delay our gastric emptying is what we call it, delay, our bowels from forming. And then also, if we have things heavy in the soluble fiber area, so like I talked about before, we have both soluble and insoluble fiber. Insoluble fiber is going to help that GI tract move your stool. But if we have foods too heavy in that soluble fiber category, that's going to kind of back us up a little bit more.
What are some examples of those foods?
Yes. So if we have anything in excess, like beans, for example, in excess, that can sometimes cause a lot of excess soluble fiber, and that can kind of back us up. However, beans in moderation are totally fine. I'm trying to think of some others. There's, having, rice, barley, every food has a little bit of soluble and insoluble fiber, so it can be a little difficult. Maybe, having more of those just general carbs that don't have fiber in it too, like white breads, things of that nature, that can also cause some constipation too.
So maybe switching from like white rice to brown rice.
Exactly.
And white bread to whole wheat bread.
Exactly, yeah. Try to get as much whole wheat into your diet as possible. Yeah.
So we have a question here, and then I got you too, so don't worry.
Are there any foods or drinks that you may recommend that may interfere with dopamine production, or the chemical reaction in your brain that can cause more issues with Parkinson's?
Oh, sorry, I was trying to locate you. Yeah, so iron can actually sometimes cause it to be difficult to absorb our medications. So that's something I would recommend. If you do have to take an iron supplement, do it at least 2 hours after your medication. But iron-rich foods are usually found in leafy greens. They're also found in a lot of red meats, also found in nuts, things of that nature. So, trying not to have a very heavily iron diet is important. And if you are having to take that supplement, do it, a couple hours after your medication.
We had a question over here.
Yes, sir. Thank you. Hello. I'm kind of noticing a trend about, especially for folks with Parkinson's, how important exercise and proper hydration is. I was wondering if you two had any thoughts about supplementing with creatine, given that it's relatively inexpensive. It seems like it's conducive to exercise, and it does promote water retention. From my knowledge, I'm not an expert, but creatines are relatively, there's a lot of information about it.
Not really.
Yeah, me either.
Yeah, I haven't seen anything specifically studying creatine in patients with Parkinson's disease. I would say that it's certainly an option. It's not sort of the only option or the best option for increasing hydration. Generally speaking, in addition to the actual water intake, patients with Parkinson's do also need to be taking in enough salt and other electrolytes, which are really important for the kidneys to be able to absorb more water and not excrete it. So that's sort of the major essential that patients need to watch out for, that they're not just increasing their water intake, but also increasing salt intake.
Just one comment on creatine. There was a study a long time ago, and Dr. Ross, who's going to talk about research, we can ask him that when he does, but they were looking at creatine to help with the motor symptoms of Parkinson's, I believe, and so, which I don't think that it showed any benefit, but we'll kick that over to Dr. Ross on his talk later on. Yeah.
How does alcohol factor into all of this?
Good question. Yes. So in moderation, alcohol is protective of the cardiovascular system with potentially modest benefit to the cerebrovascular system. However, in excess, it can actually promote neurodegeneration. So the recommendation is to drink no more than the Heart Association designated amounts, which is no more than 2 drinks for men per day and no more than 1 drink for women per day. I will say there are potentially other risks to alcohol consumption in patients with neurological illness, including impact to balance and other motor symptoms and cognition and mood impairment. So my general recommendation is to try to limit it.
Any other questions for the audience? Yep. Okay.
Just wondered if you'd find a little time to comment on a couple of things like the intermittent ketosis. Is there any value there? And possibly the care and feeding of the gut biome, and anything about glycosates or Roundup, and then choosing foods that aren't contaminated with that.
So first off, we have seen some benefits with the keto diet and Parkinson's disease with reducing symptoms. However, it's very hard to have a ketogenic diet that's primarily just on unsaturated fats. So I think, unfortunately, when we recommend like a ketogenic diet, people do take on a lot more saturated fats. And that can really, affect our cardiovascular health. It's not something that I would really recommend to patients. I would probably recommend more of that Mediterranean diet with doing the protein redistribution and having more plant-based proteins. So we do have some research showing that can help with symptom management, but it's not something I would recommend to all patients. Mm-hmm. And what was your other question again?
The gut microbiome.
Like, how does... we unfortunately don't have that much research on that yet. We have seen some probiotics benefiting the gut, which again impacts Parkinson's disease, and I think that's really where research is starting to go now, is we're realizing like how important that gut microbiome is. But I would always recommend having probiotics through our foods than just through our supplements. We're not at that stage yet where we can formally recommend like one strain is going to help you, because everyone's gut microbiomes is going to react differently, and we have so many other strains in there. So trying to have, sauerkraut or kimchi and just any other type of probiotic foods that is going to likely improve our Parkinson's disease symptoms. But we're just not at that stage where we can definitively say, this certain strain helps with, our gut microbiome. Does that kind of help answer that?
Yeah, I think the short answer is yes, there is certainly a relationship that has been found through emerging research, but most of the research targets are trying to answer the question of, what changes in the gut microbiome are responsible for factors that lead to development of Parkinson's disease. So, none of the results of research have really led to recommendations on how to, change your diet or implement strategies once you've already developed Parkinson's disease. But as Alyssa has mentioned, sort of some general advice to eat, anti-inflammatory foods like probiotic-rich foods and antioxidant-rich foods. So that's sort of the best advice we can extrapolate.
We have a couple of questions.
Kevin, there's a question here. She's been waiting a while.
Right.
My question is, does artificial sweetener, large consumption of artificial sweetener cause Parkinson's?
I haven't seen that is directly correlated to Parkinson's in any research. However, I don't highly recommend artificial sweeteners. It of course depends, if you have diabetes, then it might be a little bit more beneficial than if you do not. But artificial sweeteners do impact our gut. So we want to try to limit sweeteners across the board as much as possible. And that includes both artificial and, regular sweeteners. Would you concur?
Yeah, I would concur, and I might punt this to Dr. Ross in his section. Any research on artificial sweeteners implicated in Parkinson's? No. Okay.
Question right over here.
This is in relation to the gentleman who had the constipation question. If it's due to slow gastric emptying or delayed gastric emptying, I found that you can do massage to help move the bowel through. There's something called the LUV massage, and you can find it on YouTube. It's LUV, and it helps to move the bowel through your small intestine system.
Great, thank you. Thank you for sharing that. Do we have any other questions? Okay, we have one back there and one over here, so why don't we'll go back there first, that gentleman. While we're waiting for the microphone, we have a couple more questions too that were sent in. What are the healthiest anti-inflammatory foods, and what foods should I stay away from?
Yeah, so you got it.
Yeah, so we've kind of answered some of these questions. So some of the healthiest foods would be, foods rich in antioxidants. That includes things like, leafy green vegetables, nuts and seeds, fruits, especially berries. Again, alcohol, particularly red wine, but in moderation. Some probiotic foods you were mentioning, kimchi. I'll also add on to that yogurt,
Yes.
which is better than actually taking a probiotic supplement. So those are some foods that you can increase your consumption of. Really, basically, the more plants you can take in, the better. And then on the flip side of that, we've implicated red meat and whole fat dairy and heavily processed foods. Enriched white grains. Those are the foods to really limit and avoid. Deep fried foods, etc.
Great. Question right over here.
Do you have any thoughts on fasting? Any suggestions?
I haven't formally seen much research with fastings and Parkinson's disease specifically. In general, dietitians try not to recommend intermittent fasting. I know that's kind of become a pretty big trend. It usually leads to eating disorders and an unhealthy relationship with food. In addition, a lot of the benefits that we've seen with intermittent fasting is usually when you eat within that 10-hour, 8-hour period, which we kind of already do, right? So if you're eating, from 8 a.m. until, or maybe 9 to 5 p.m. in that kind of time frame, that's going to, yield the best results than people who end up fasting for days on end or, having that 2-hour time period. We haven't seen as much success with that. So I would kind of recommend against fasting and just trying to listen to your body and eat healthy.
Yeah, I agree. I usually don't recommend intermittent fasting, especially in Parkinson's, because it can exacerbate a lot of the issues that we've already talked about, like, for instance, constipation. So a fasting diet can discourage against, excess extra hydration. It can make weight loss worse. It can make the delayed gastric emptying worse. Since typically people who are fasting will eat large amounts in a small window, but then not eat outside of that window. So a lot of the symptoms that patients with Parkinson's disease face can be worsened by fasting.
Yeah, good morning. What are your thoughts on medical marijuana diet?
What diet?
Medical marijuana diet or
Oh. There's too much research on that.
Yeah, I'm going to claim not enough research. There are definitely benefits and risks. One of the benefits being that it can stimulate diet. So in somebody who has, for example, extreme nausea and reduced appetite and weight loss, it could potentially be an option. That being said, there are, of course, risks. So I think it's an individual discussion with your provider on those risks and benefits and whether it is good for you.
Yeah, and there is a medication called Marinol that you could talk to your provider about. It kind of, has that same, it is a synthetic cannabinoid, but it can help improve your appetite, reduce your nausea. However, it doesn't have those negative effects of like getting high. So that's something that you could inquire with your provider about. That's an option.
We have time for just one more question. We can do two. Okay, I'm a softie.
I'm talking about constipation. If I know that before when I was walking a lot and running and doing all kinds of exercise, I had no problems. But now I cannot. Therefore, I take my Lenta almost every night. It helps. But what is your opinion on taking artificial means for
Can you repeat the question?
So it seems like she's saying she used to exercise a lot and her bowels were moving great, but she's been having a little bit of more difficulties now, and so she's been taking a laxative at home. Is that correct?
Yes, I'm not able to run or do all my exercises. Therefore, I know the gut movement by moving your legs and whatnot helps.
Right. Yeah, and if we're getting to the point where, exercise is difficult for us, then we might have to move towards laxatives. Trying to get it through food and fluid is always going to be our best option because we can get often reliant on those laxatives. But if you're not able to get it through the food and our fluids, then, that might be an option that you have to explore with your provider.
Okay, we have a question over here.
So I had a question in regards to hydration and getting the adequate amount. So how much do drinks like diuretics, like tea and coffee, contribute to the count, the intake count? And then if you're drinking a lot of coffee or tea, then how much should you replace with just water or some kind of other beverage?
I don't think that there's a formula for how much replacement there is, but you may have to use your judgment and try to replace all of the fluid that you've lost through diuresis. I try not to tell people to stop drinking their coffee because I know there's going to be backlash with that, but maybe consider reducing the intake, reducing the number of caffeinated drinks per day. Generally speaking, out of all of the fluid that you drink in the day, we kind of suggest that about half of it is plain water, and then the other half comes from things like soups and smoothies, maybe electrolyte drinks, or other non-water sources.
Thank you so much.
And one way that you can kind of tell if you're hydrated or not is really through your pee color. Like our bodies tell us so much. So if we're having a very light yellow urine output, that's great. That's kind of one way you can tell. If it's that darker color or bright yellow, that means that we're not drinking enough. So that's a good way to kind of monitor our own body.
Okay, we're going to do one more question, and then if you have questions that you didn't get answered, if you could just come up to me and we'll get the question written down and get your answer basically offline. So last question over here.
So what are your thoughts? This is a non-nutrition and diet-related question, but what are your thoughts regarding acupuncture or other Asian-related medications that are available?
Yeah, so this is a big topic that we don't quite have time for today. There's a lot of different complementary therapies out there, and we kind of try to examine each one through sort of the lens of what evidence is there to support it and what are the potential risks. A lot of the ones that that patients are often interested in, like acupuncture, have maybe a little bit of some weak supportive evidence and not a whole lot of risk. So in that sort of risk-benefit balance, I don't really recommend or discourage it. I think some patients will end up benefiting and others won't. So if it's something that you're specifically interested in and wanting to try, I would encourage.
Okay, so it is 10 o'clock on the dot. I can't believe it. We even got those extra questions in. Okay, so first of all, thank you to our panelists.